Hello, I'm Elizabeth John, and I'm an ophthalmologist and oculoplastic specialist. Today, I'm going to talk about what is glaucoma. So glaucoma is a disease of the optic nerve. You need three things to see. You need your eyes that collect the information, your brain to process the information, and the optic nerve, which sends the information from the eye to the brain. Think about a TV and a Blu-ray player. Your TV could be working just fine. Your Blu-ray player could be working just fine, but the cable between the two isn't working, then you're not going to be able to watch a movie on your television. So that's similar with the optic nerve. If something happens to your optic nerve, that information from your eye can't be transmitted to your brain, and so you won't have vision or you'll have disturbances in your vision. So with glaucoma, what happens is that usually when you have glaucoma, you start to lose vision in the periphery, like out to the side. And so people don't notice when they lose that peripheral vision. And it's not until they get tunnel vision and they're only looking at the very small tunnel that they actually notice that they're losing vision from glaucoma. This is why it's actually important to have eye exams. Glaucoma is genetically related. There are many genes that have been found to be related to glaucoma. And so if you have a family history of glaucoma, you do want to get eye exams to get checked for glaucoma. So if your father or mother had glaucoma and they were diagnosed around age 60 or 70, then you should probably have eye exams about a decade earlier than that. So if they got diagnosed at 63, you should start having annual eye exams at 53 to look for glaucoma. If they got diagnosed even younger, then you want to go in even younger. Generally, glaucoma is more common as you get older, though there is some glaucoma that affects babies or young children, and those are due to different genes. So the most common glaucomas are ones that do affect people as they get older. When you go in for an eye exam, the eyes are dilated and we actually look at the optic nerve, and so we can actually see the optic nerve. We look at something called the cup to disc ratio. A normal cup to disc ratio is anywhere from 0.1 to 0.5. There are some people who may have a cup to disc ratio larger than 0.5 and have that be totally normal from them. And we call that physiological cupping. Some people have larger nerves. And so if the nerve is larger, then the cup inside the nerve can also be larger. The amount of nerve fiber layer may be the same. And so there is a test that can be done called the OCT, and that can actually scan your optic nerve and quantify just how much of the RNFL, the nerve fiber layer, there is to the optic nerve. And it can actually compare you across normals for your age. And so this is typically the first test that I do if I see someone who has a large cup to disc ratio. The other component of glaucoma is eye pressure. So you can have a normal eye pressure and still develop glaucoma. We call that normal tension glaucoma. But often if the eye pressure is high, you're more likely to develop glaucoma. And if you can get that eye pressure down, then you can actually avoid vision loss from glaucoma or even avoid kind of developing glaucoma. And so if your eye pressure is above the normal range, we call that ocular hypertension. So you can have ocular hypertension without actually having glaucoma. Your optic nerves could still be healthy and not being affected by that higher pressure. But there have been studies that show that if you lower that high eye pressure, then you do decrease your risk of developing glaucoma. So how do you lower eye pressure? Well, there are basically three ways. You can do it through eye drops, and the drops lower the eye pressure by either decreasing the amount of fluid that your eye produces or increasing the rate of the fluid leaving the eye. You can also have laser treatment, which basically makes it so that the fluid can leave your eye faster. And then the last way is surgery, and surgery typically is just also a way to get more fluid to leave the eye. So basically your eye is always producing fluid and there's always fluid leaving, and that's how you how the eye can control the eye pressure. And so just by balancing that, you can actually change the eye pressure. So normal eye pressure, the upper end of normal is 21. The corneal thickness will also impact the eye pressure. So when we check eye pressure, we assume a normal corneal thickness, but some people have thicker corneas and some people have thinner corneas. when we measure the eye pressure, if someone has a thinner cornea, then the actual eye pressure is likely higher than the pressure we measure. Conversely, if someone has a thicker cornea, then the pressure we measure is actually lower than the actual pressure. So there is a way to measure corneal thickness, and then we can use that to kind of adjust the measured eye pressure as well. So that's a lot of information for you, but just giving you some insight on what glaucoma is. So if you do have glaucoma, that's why we do that test, the OCT, to look at the nerve fiber layer. We also do a visual field test in order to see if you're actually losing vision in that in the periphery, because again, you don't really notice when you lose vision in the periphery. And so these are tests that are done routinely in order to see where you're at. And if we start to notice vision loss, then we know we need to get the pressure lower. So the treatment for glaucoma is lowering the eye pressure. And typically once you get the eye pressure low enough, you can prevent vision loss. But once vision is lost from glaucoma, you can't get it back. And that's why it's so important to get early treatment and get your eye exams. Well, I hope this video was educational for you. If you like these videos, please subscribe to this YouTube channel so that you can learn more about your eyes. Thank you.